Hi everyone, welcome back to another video on healthy living. Today we're going to discuss about why the ketogenic diet works so well for some people, yet completely stops working for others, or why you may lose weight at first, only to hit a frustrating plateau. Millions of people across the United States adopt keto with the goal of losing weight, improving metabolic health, and reversing insulin resistance. However, despite its popularity, a large percentage of individuals fail to experience long-term success. As a medical professional, I want to clarify something very important from the beginning. Keto itself is not the problem. The real issue is how keto is practiced. When done incorrectly, it can lead to hormonal imbalance, nutritional deficiencies, and metabolic confusion. When done correctly, it can be a powerful therapeutic tool. Today on Prime Health Official, I will walk you through the 13 biggest ketogenic diet mistakes. These are not opinions or internet myths. They are based on established medical science, metabolic physiology, and clinical observations. If you are currently on keto, planning to start keto, or struggling with results, understanding these mistakes could significantly improve your health outcomes. The first major mistake is believing that keto simply means eating fat and automatically losing weight. Ketosis is not triggered by fat intake alone. It is a metabolic state achieved when carbohydrate intake is sufficiently reduced, insulin levels fall, and the liver begins producing ketone bodies from fat. Many people adopt what is commonly referred to as junk keto, consuming processed meats, artificial cheeses, and low-quality fats while avoiding vegetables entirely. From a medical perspective, this approach promotes inflammation, disrupts gut health, and deprives the body of essential micronutrients. A well-formulated ketogenic diet includes high-quality fats, moderate protein, nutrient-dense vegetables, and adequate minerals. Fat quality matters just as much as fat quantity. The second mistake is consuming excessive protein. Protein is essential for muscle maintenance, immune function, and hormone production. However, keto is not a high-protein diet. When protein intake exceeds the body's needs, excess amino acids are converted into glucose through a process known as gluconeogenesis. This increase in glucose stimulates insulin release, which directly inhibits fat burning and ketone production. Clinically, I often see patients unknowingly pushing themselves out of ketosis by over-consuming protein. The correct approach is moderate protein intake, calculated based on lean body mass rather than total body weight. Another extremely common and medically significant mistake is avoiding salt. For decades, people have been conditioned to fear sodium. However, when insulin levels drop on keto, the kidneys excrete more sodium and water. This loss of sodium also leads to depletion of potassium and magnesium. The result is fatigue, dizziness, headaches, muscle cramps, and heart palpitations, symptoms often mislabeled as the keto flu. In reality, this is electrolyte imbalance. From a clinical standpoint, adequate sodium intake is essential on keto, along with potassium from vegetables and magnesium supplementation to support neuromuscular function and cardiovascular stability. The fourth mistake is under-eating calories. Many individuals combine keto with aggressive calorie restriction, believing this will accelerate weight loss. Unfortunately, the human body does not respond well to prolonged under-eating. Severe calorie restriction increases cortisol, suppresses thyroid hormones, and slows metabolic rate. This phenomenon, known as metabolic adaptation, causes the body to conserve energy and resist fat loss. Medically speaking, keto should support hormonal balance, not disrupt it. Adequate caloric intake is essential for sustainable metabolic health. Ignoring fiber and gut health is another critical error. While keto is low in carbohydrates, it should not be devoid of fiber. The gut microbiome relies on fermentable fibers to maintain intestinal integrity, immune regulation, and metabolic signaling. A lack of fiber can lead to constipation, inflammation, and impaired nutrient absorption. Research consistently shows that gut health plays a direct role in insulin sensitivity and weight regulation. Keto-friendly fiber sources such as avocados, leafy greens, seeds, and low-carb vegetables should be a consistent part of the diet. The sixth mistake involves reliance on processed keto products. Many foods marketed as keto-friendly contain hidden sugars, insulin-spiking additives, and artificial sweeteners such as maltodextrin and sucralose. While these ingredients may not raise blood glucose significantly, they can still provoke insulin release and disrupt gut bacteria. Clinically, this leads to stalled weight loss, increased cravings, and metabolic instability. A therapeutic ketogenic diet is based on whole, minimally processed foods, not packaged substitutes. Chronic stress and poor sleep represent another major barrier to success. From a medical perspective, cortisol is one of the most powerful regulators of blood sugar. High stress levels and sleep deprivation elevate cortisol, which raises glucose and suppresses ketosis. Research shows that sleep deprivation alone can reduce insulin sensitivity by up to 30%. Even a perfectly structured diet cannot overcome chronic stress and inadequate sleep. Prioritizing rest and stress management is not optional, it is essential. Unrealistic expectations are also a common reason people abandon keto prematurely. The rapid weight loss seen during the first week of keto is largely due to water loss, not fat loss. True fat adaptation requires time. Mitochondria need weeks to become efficient at using ketones for energy. From a physiological standpoint, this adaptation phase can take 3 to 6 weeks or longer. Quitting early prevents the body from reaching its full fat-burning potential. Dehydration is another frequently overlooked issue. Low insulin levels increase water excretion, which raises fluid requirements. Dehydration can mimic hunger, increase fatigue, and impair physical and cognitive performance. Proper hydration supports kidney function, electrolyte balance, and ketone production. Clinically, urine color is a simple hydration indicator. It should be pale yellow, not dark and not completely clear. Another mistake is remaining in strict keto indefinitely without reassessment. While keto is a powerful metabolic intervention, it may not be appropriate as a permanent strategy for everyone. Some individuals experience thyroid suppression, reduced leptin signaling, or hormonal irregularities over time. Medical literature supports the concept of metabolic flexibility, where the body can efficiently use both fats and carbohydrates when needed. Strategic carbohydrate cycling or periodic reassessment may be beneficial for long-term health. Micronutrient neglect is another serious concern. Keto diets that lack food variety often result in deficiencies in magnesium, potassium, selenium, and vitamin D. These nutrients are essential for nerve conduction, muscle contraction, immune function, and hormonal balance. In clinical practice, micronutrient deficiencies are a common cause of fatigue, weakness, and plateaus. Food quality and nutrient density must always take priority over macro tracking. Comparing results with others is another psychological and physiological mistake. Every individual has a unique metabolic profile influenced by genetics, insulin sensitivity, hormone levels, age, sex, and medication use. Women, in particular, may experience different responses due to hormonal fluctuations throughout the menstrual cycle. From a medical standpoint, ketogenic therapy must be individualized. There is no universal timeline or outcome. The final and most important mistake is failing to consult a qualified medical professional. Keto can significantly alter blood sugar, blood pressure, and medication requirements, sometimes within days. For individuals with diabetes, hypertension, thyroid disorders, or those taking prescription medications, unsupervised keto can pose serious risks. Medical oversight ensures safety, proper adjustments, and optimal results. In closing, the ketogenic diet is not a trend or a shortcut. It is a metabolic tool rooted in biochemistry and clinical medicine. When practiced correctly, it can improve insulin sensitivity, support brain health, stabilize energy levels, and promote sustainable fat loss. When practiced incorrectly, it leads to frustration and unnecessary health complications. Understanding these 13 mistakes allows you to approach keto with knowledge rather than guesswork. At Prime Health Official, our mission is to provide evidence-based education so you can make confident decisions about your health. If this information helped you, stay connected with us for more medically grounded insights, because your health deserves clarity, not confusion. Bye. See you in next video.